There's not that many people who can approach the blood vessel from both the outside and the inside, and so I'm not limited in terms of what I can do. If something needs to be done with open surgery, I can do it, or if it needs to be done from the inside of the vessel, I can do it. For me, that's what I want to be able to offer every treatment possible and try and do whatever's best for that particular individual in that setting. When you're talking about a disease like a brain aneurysm, there's usually many ways to treat it, and traditionally it was with open surgery. It's evolved more, and so now it's typically through interventional techniques, but often that's not the best way, or there's certainly times where that's not going to be the best approach. And if you're seeing someone who can only do it one way, you know, the old saying about it, if your only tool is a hammer, everything looks like a nail. I'm not limited that way. I can approach the aneurysm traditionally if it needs to be clipped, if that's the safest thing, where open surgery is the best approach, versus somebody who doesn't do that, even in the best of settings, will often be swayed by the one way that they know how to fix the aneurysm. So I'm free that way in terms of being able to do either of those procedures, or coming at an aneurysm from the inside or the outside. I try and look at every patient as sort of an individual with their own needs, and what's best for one person in one situation is not always the case for each person. And if you have every option available and you're focused on just getting the best possible outcome, you're not limited in terms of what you can do and how you can do that. Another maybe good example would be like with arteriovenous malformations. I can look at how best to treat it, which usually involves some kind of surgical resection of the arteriovenous malformation, but I'll do my own embolizations ahead of time, and I target the embolizations to make the surgery easier. And since I'm going to be doing the surgery, I know exactly where I need to embolize. It's going to make the surgery safer and better. I don't have to push the embolization in certain places where it's going to be more dangerous. So that's a good place where having the skills for both neurointervention and neurosurgery combined to get the best result for people.